Well, good afternoon. I see we have a large crowd today, and we'll get to that later on the agenda. If I could ask you to stand and ask Chaplain Morgan Medford to lead us in the invocation.
Let's go to the Lord in prayer. Most gracious Heavenly Father, thank you for the privilege of serving you and serving you here among these people. Lord, thank you that each one of us are able physically to be here in this room today and not across the street in a hospital bed, enduring so many different things. Lord, thank you for the opportunity you've given us to help other people in some very difficult situations. Lord, I pray that this meeting today helps people, a lot of people, not just today, but every day. Lord, use us as instruments in your hands to help other people to have a better life, a more full life, a life that has joy and meaning to them. Lord, please, I pray that you give each one of our board members wisdom, give them a clear vision of what it is they need to do, and help us, Lord, each one to be used to bring honor and glory to you and be a great help to so many people who are in physical need. And Lord, we pray this all in your precious name. Amen.
Amen. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, thank you, everyone. I call this meeting of the Sarasota County Public Hospital Board to order, and I have a statement to read about public comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen's comment pertains to an item on the agenda today, the comment will be heard early in the meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Thank you. All right. Let's see. Okay. We have a proposed amendment to the orders of the day. Mr. Hudson?
Mr. Chairman, I'd like to move that we amend the orders of the day to add item Roman numeral 12.A.3, approval of the selection committee rankings for the general contractors and architects, engineers for the renovation of operating room number 21.
Any comment? All those in favor signify by saying yes.
Yes.
Yes. Opposed, no. All righty, thank you. Next, we'll ask for approval of those orders of the day.
I move approval of the orders of the day.
All those in favor signify by saying yes.
Yes.
Opposed, no. All righty. Let's see, next we have the, ask for a motion for the approval of May meeting. Excuse me, the June meeting.
Mr. Chairman, I move approval of the minutes of the June 18th meeting.
All right. Comment? All those in favor signify by saying yes.
Yes.
Opposed, no. All righty. Good. We have no board reports, so with that, we'll deal with the large crowd that we have today. And Dave, if I could call on you to introduce Dr. Berg.
Sure, it's my pleasure to get to introduce Dr. Berg today. So Dr. Berg received his undergraduate degree and his Doctor of Medicine degree from University of Illinois. He completed his internship and residency in internal medicine, followed by a fellowship in pulmonary and critical care medicine at the University of Michigan. After his medical training, he served as a major in the United States Air Force and director of pulmonary division at Keesler Air Force Base. After his military service, he entered a pulmonary medicine practice in Sarasota, Florida. He developed an interest in information systems and administrative medicine, and that led to his selection as to lead the lead physician to help install electronic medical record at SMH. He subsequently became the Chief Medical Information Officer and then the Patient Safety Officer for the hospital. He also serves as a consultant around the country for electronic medical record, patient safety, and physician behavior issues and bioethics. So on top of all that, I think just to let the board know, for those of you who may not, Dr. Berg was the inaugural and the only Dean of Medicine here at Sarasota Memorial's campus of FSU. And Dr. Berg is retiring come this November, I believe. Nod, if that's correct, okay? And so I just want to pass on our thanks from the hospital, on behalf of the board, for everything that you've done for this community, for what you've done for this hospital, and your service for everything. So thank you, Dr. Berg.
Thank you. Thank you very much. Well, once again, I want to thank all of you for allowing me to present to you our newest third-year medical student class for the FSU College of Medicine. Today we have before you the class of 2020, sort of difficult to believe, actually. They represent our 14th medical student class here at the campus, and with their arrival, we just graduated the class of 2018, and they have gone off to their residency programs, and with their departure from our campus alone, we have now graduated 208 physicians, matriculated them into the MD degree. And many of our graduates have already completed their residency program since we've been here for 14 years, and they have begun to return not only to our community to practice in Sarasota Memorial Hospital, but also in Sarasota County and the surrounding counties. And that's really part of our mission as the College of Medicine, to produce new physicians for the state of Florida, and particularly for the areas in which we have our regional campuses. And I think we've been reasonably successful at doing that. The students are glad to be in your hospital, and I am very glad to have them here. It is absolutely a world-class hospital. For those of you that have been elsewhere, you know that. And when our students are here and then they go away to their elective rotations to different hospitals, particularly those out of state, they come back and realize this truly is a world-class hospital, and they will attest to that. And thank you all for the leadership you provide, and the fact that it's a public hospital, I think, puts it in a very special class. We will introduce the students. We have two students who couldn't be here today. They're in a pediatric rural rotation in Immokalee, where we have a campus. And Kevin Gill is one who is from Miami, Florida, and he had his undergraduate degree from FSU in exercise science. And Megan Rivera, and she's from Charleston, South Carolina, and she had her undergraduate degree from Ave Maria University in biochemistry. So with that, I think we will have the students come up, and they will do the same and give you their names and where they graduated from. I think it's alphabetical.
Hi, my name is Julia Ahn. I was born in Dunedin, Florida, and I had my undergraduate education at the University of South Florida in Tampa.
Thank you.
Hello, everyone. My name is Alexander Barati. I'm 31 years old, and I'm originally from San Francisco, California. Graduated from the University of California, Santa Barbara with a degree in biopsychology in 2009, and moved to Florida in 2015. Thank you.
Hello, my name is Paige Blinn. I am from Clearwater, Florida, and I did my undergraduate at Florida State and with a degree in exercise science.
Hello, my name is Edward Cordy. I'm from St. Petersburg, Florida. I did my undergraduate degree at Johns Hopkins University and majored in Spanish, and happy to be back in Florida.
Hi, I'm Jenna DiFrancesco. I'm originally from Naples, Florida, so I'm happy to be closer to home. I went to FSU for undergrad as well and graduated with a degree in biology.
Hello, everybody. My name is Shane. I'm not a native Floridian, but I've been here since 2000. Really enjoy the state of Florida and look forward to coming back here to practice. Thank you. I got my undergraduate degree from University of Central Florida.
Howdy, y'all. My name's Charlotte George. I'm originally from Kentucky, but I went to high school actually in Lakewood Ranch for a few years, so I'm kind of familiar with the area. I went to undergraduate at Florida State and continue there. Thanks.
I'm not the newest medical student, although I would like to be. I'm here to apologize. Both Kevin Gill and Megan Rivera did make it from Immokalee. Thank you.
So I guess I already had a pre-introduction. But my name's Kevin Gill. I'm from Miami, born and raised. I went to Florida State for undergrad, where I did exercise science. So I guess I'm a Florida State thoroughbred. Came here for med school again. Happy to be here.
Hello, my name is Christopher Hahn, and I'm from Tampa, Florida. I went to Florida State for undergrad and got a degree in biology.
Hi, my name's Ariana Ismaili. I grew up in Palm Harbor, Florida. I attended Florida State University and received a degree in biology as well.
Hello, my name is Jasmine Jordan. I actually was born and raised in Sarasota, Florida. Fun fact, I was actually born in this hospital, so it's good to be back. I received my education at USF for my undergraduate education, and I got my master's also at USF, so thank you to be here, Seth.
Hi, my name is Marissa Lockery. I'm from Merritt Island, which is an hour east of Orlando. I went to FSU for undergrad, so go Knowles, and I had a major in biology.
Hello, my name is Chelsea Life. I'm from Ocala, Florida. I received my undergrad from Florida State University, and I got my bachelor's in exercise science. Thank you.
Good afternoon, everybody. My name is Taylor Maramara. I am born and raised in Tampa, Florida, and I studied exercise science at Florida State University.
Hi, good afternoon. I'm Wes Parker. I was born and raised in Houston, Texas. Did my undergrad at Florida State and just stayed in Tallahassee for the next couple of years, and happy to be down in Sarasota. It's paradise.
Hi, I'm Haley Parsley. I was raised for a good amount in Tallahassee, Florida, and I graduated from the University of South Florida with a degree in animal biology and a minor in Spanish.
Hi, my name is Megan Rivera. I had a little bit of a pre-introduction, but I was born in Charleston, South Carolina, but I grew up a military brat, so I was kind of from all over. My family's currently in Naples, Florida. And I went to Ave Maria University and I have a degree in biochemistry. Thank you.
Hi, my name is Danielle Shore. I'm from Fort Lauderdale, Florida, and I graduated from Florida State University with a degree in biology.
Hello, my name is Tyler Turlings. I was raised in Merritt Island, Florida. I went to University of Florida for undergrad. I got a degree in applied physiology and kinesiology, and then I transferred to FSU for medical school, and I'm happy to be in Sarasota.
Good afternoon. My name is Tyler Wickus. I'm originally born and raised in Cocoa Beach, Florida. I got my undergraduate degree at USF in Tampa in biomedical sciences, and happy to be in Sarasota now.
Good afternoon. My name is DeAndre Williams, and I was originally born in Brooklyn, New York, but I've been raised here, actually in Tampa, Florida, for most of my life. I ended up going to the University of South Florida in Tampa for my undergraduate degree, where I received a degree for biomedical sciences, and now I'm here at Sarasota Memorial. Thank you.
Again, I just want to extend my personal thanks to everyone here because you have really helped me tremendously, not only with this campus, but in my time here at the hospital. And I am certain that the next dean will take the campus to the next level and will work with you extremely well. Thank you much.
Dave, I'm just going to let the crowd settle for a minute.
put your surprise face on.
No, I don't feel it.
Thank you.
All right, next on our agenda is the Excel Award for this month. And Dave, if you would do the introduction.
So I'd like, I have the privilege of introducing you to our July Excel Award winner, Melissa Shelton. Melissa, come on up. How are you? Good, good. So I'm going to say some nice things about you, if that's okay. Absolutely. Okay. The Excel recipient for the month of July is Melissa Shelton. Melissa is a nurse quality program educator, a coordinator in education, professional development, and research. She's been an employee of SMH since May of 2015. Melissa is a consummate professional in every way. She has contributed so much to the Division of Nursing from a quality, research, and innovative perspective. She is committed to providing the absolute highest quality of care demonstrated by her tireless work ethic, intellectual brilliance, and compassionate caring behavior. Melissa is always kind, patient, and respectful. She actively role models closed-loop communication techniques and is a true believer of respectful communication to support teamwork, as evidenced by her commitment to Team Steps. Melissa is multi-talented, stellar employee, and one of the most professional persons I've ever worked with. She lives in downtown Tampa, which is less than a mile from Tampa General, and chooses to drive 80 miles each way and every day because she cares about this community and commitment of SMH. So, Melissa, thank you so much for everything. Tram?
Hey, Melissa, on behalf of the board and management of the hospital, I'm pleased to present this Excel Award plaque to you. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort, and for driving 80 miles a day, that is extra, each way, that is extra effort in the quality and care of our patients and families in the community. Hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Melissa Sheldon with the Excel Award for the month of July 2018, signed by our president and also signed by our chairman of the board. And congratulations. Terrific. Thank you. You get to say a few words.
Thank you so much for this award. It really is an honor to work here, and I appreciate all the people that I get to work with each day. It's worth the drive.
Thank you.
All right, next up, we have the report of the medical staff. Dr. Gardner.
Thank you, Mr. Chairman. The Medical Executive Committee has been working diligently to update the litany of forms and rules to make this hospital run. And most recently, we have updated the emergency medicine, urgent care, pediatric, and neonatology privilege forms, as well as updating the surgery department rules and credentials policy for allied practice professionals. And so we have some motions to be brought forth to the committee.
So, Mr. Chairman, I have three motions. The first is I move approval of the emergency medicine, urgent care, pediatric, and neonatology privilege forms as recommended by the Medical Executive Committee.
I second that motion.
Any questions? All those in favor signify by saying yes.
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 Opposed, no? Okay.
All right. The second motion is I move approval of the surgery department rules as approved by the department and recommended by the Medical Executive Committee.
Second. Motion and a second. Any discussion? All those in favor signify by saying yes.
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 Opposed, no? Okay.
And third, I move approval of the credentials policy amendment to add the requirement for basic life support certification for all advanced practice professionals, sometimes designated as allied health professionals, in the bylaws and bylaws-related documents as recommended by the Medical Executive Committee.
Second. Okay. Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no? All right. Thank you, Bill.
You're welcome.
Anything else?
That concludes my report.
All right, excellent. Thank you very much. Foundation report, Mason Ayers.
All right, thank you, Mr. Chair. We've been busy at the Healthcare Foundation preparing for our upcoming event season, and our first event for this coming year is going to be held on October 11th, which is the 13th annual Key to the Cure event. And the subtitle is Party with a Purpose. We are expecting around 1,000 attendees again this year to come to Saks, Fifth Avenue, starting at 5:30. And this year, we are going to continue to raise money for the Women's Cancer Program at SMH. To date, this particular event has raised over $1.5 million for Women's Cancer Program, so I would encourage you and the community to come join us on October 11th. And that concludes my report, Mr. Chair.
Well, thank you, Mason. That is an exciting and different event, so
Yes.
I encourage everyone to book early. All right, Tram, the Secretary's report.
Mr. Chairman, I would like to present the hospital board calendar for the month of August. We will be meeting on August the 20th at 9 a.m. for Mission and Planning Committee. We are going to be involved in that meeting for the full morning portion. At noon, we will have a closed session to do peer review. At 12:30, we will conduct our financial review and issue review. And at 2 o'clock in this room, we will have our board meeting. On Wednesday, August the 29th, we will start at 8 a.m. in a board budget retreat. And at 9:30 that morning, the Finance Committee will convene. Those are the only meetings we have scheduled for August.
Any questions? Thank you, Tram. Treasurer's report. Sharon?
Yes, I'd like to propose a motion. I move approval of bad debts and charity care for the month ended June 30th, 2018 in the amount of $13,285,000.
You have a motion, second? Second. Motion and second. Any questions, comments? All those in favor signify by saying yes. Yes. Opposed, no. All right. Anything else, Sharon?
That ends my report,
All right.
Mr. Chairman.
Great, thank you. Bill Wojin, CFO.
Good afternoon. I have the financial highlights for June, and June representing the end of our third fiscal quarter, so these numbers represent 9 months of activity on the fiscal year-to-date numbers. I'll start with the operating revenue for the system. For the month of June, our operating revenue was $85,140,000 compared to a budget of $64,864,000. Fiscal year-to-date, through 9 months again, operating revenue of $667,222,000 compared to a budget of $595,859,000. For the system's total expenses for the month of June, $64,390,000 compared to a budget of $63,252,000. Fiscal year-to-date, total expenses of $600,576,000 compared to a budget of $586,973,000. The system's operating income in the rating agency format for the month of June, $24,202,000 compared to a budget of $4,962,000. Fiscal year-to-date, that's operating income of $96,218,000, which is an operating margin of 13.6%, compared to a budget of $39,042,000, budgeted operating margin 6.1% through 9 months. Looking at hospital statistics, and these are June fiscal year-to-date numbers, average daily occupancy, 528 patients, compared to a budget of 530 patients. Admissions, 27,453 compared to a budget of 26,282. And our average acute length of stay through 9 months is 4.47 days. Last year at this time it was 4.51 days. The hospital's surgery cases through 9 months, 17,823 compared to a budget of 17,505. And so far this fiscal year, we've had 2,652 births compared to a budget of 2,705 births. Continuing statistics for the hospital, the outpatient registrations through 9 months, 350,737 compared to a budget of $340,134. Our emergency care registrations for both campuses combined through 9 months, 94,457, compared to a budget of 95,268. And our case mix index, 1.87 for all patients, and Medicare patients, 1.94. Mr. Chairman, that concludes my report.
Any questions or comments? All right, thank you, Bill. All right, we'll move on to committee reports. First up is our Finance Committee, Jim Meister.
Thank you, Mr. Chairman. The minutes of the June 18, 2018 meeting of the Finance Committee were approved. Todd Webster and Julia Safina, representing KPMG, presented the audit plan for their audit of the district's financial statements for the fiscal year ending September 30th, 2018. They covered the audit timeline, risk assessment, and management's responsibility. Mr. Webster also gave a brief overview of KPMG's role in the district's upcoming bond issuance. Bill Volgen, our CFO, gave a presentation to recommend a plan of finance for the Cancer Institute and the SMH Laurel Road Venice projects. The district plans to self-fund a large portion of the cost of these projects, but will also need to borrow approximately $375 million for construction funds. Working with Ponder and Company as financial advisor and the investment banking firms of J.P. Morgan and Citigroup, Mr. Volgen recommended the fixed-rate bond issue timed to close in late September in order to take advantage of the very favorable interest rate market. The finance team will also continue to review alternatives to potentially refinance 3 existing variable bonds issues in order to lower our cost of borrowing. I'd like to call upon our Chief Legal Officer to read the resolution, please.
Sure. Thank you very much, Mr. Meister. There we go. This is a resolution that's titled, "A Resolution Authorizing the Appropriate Officers, Professionals, and Consultants to Finalize and Implement a Financing Plan for the Issuance of Hospital Revenue Bonds and Providing an Effective Date." Whereas the Sarasota County Public Hospital District, the quote, district, close quote, is a body corporate established pursuant to Chapter 2003-359 Laws of Florida as amended, the Act, close paren, and whereas the district, through the Sarasota County Public Hospital Board, as the governing body of the district, the quote, board, close quote, close paren, is authorized by the Act, among other things, to provide at one time or from time to time for the issuance of revenue bonds of the district for the purpose of financing or refinancing the cost of acquisition and construction of extensions and additions to any hospital buildings and facilities of the district, together with equipment required in connection therewith, and to take all other actions necessary in connection therewith. And whereas the district, acting by and through the board, entered into a master trust indenture dated as of September 1, 1996, with U.S. Bank National Association as successor master trustee, the quote, master trustee, close quote, close paren, as supplemented and amended, the quote, master indenture, close quote, close paren, which governs the issuance from time to time of indebtedness of the district. And whereas the board desires to finance up to $375 million of the cost of the construction of the Cancer Institute and the Laurel Road Hospital Campus, the quote, project, close quote, close paren, through the issuance of fixed-rate revenue bonds of the district to be secured under the terms of the master indenture. And whereas it is necessary at this time to authorize the appropriate officers of the board and the district, and the boards and district's legal counsel, bond counsel, financial advisor, and investment bankers to proceed to finalize a financing plan to finance the project, the quote, financing plan, close quote, close paren, and to draft the necessary documents to implement the financing plan. Now, therefore, the Sarasota County Public Hospital Board does hereby resolve as follows. The appropriate officers of the board in the district, together with counsel to the district, Ponder and Company as financial advisor, and Squire Patton Boggs, U.S. LLP as bond counsel, and J.P. Morgan Securities and Citigroup Global Markets, Inc. as investment bankers, are authorized and directed to proceed to draft and develop the necessary documentation for the financing plan. No bonds shall be issued without the further approval of this board. This resolution will take effect immediately upon its passage, and it will be, if you approve it, passed and adopted by the board this 16th day of July 2018, to be signed by Joe DiVirgilio as chairman and Tram Hudson as board secretary.
Thank you. I move adoption of the resolution as read and as recommended by the Finance Committee.
Second.
We have a motion and second. Any discussion?
Discussion, please.
Yes, Darrell?
I like that motion very much, but I want words in it about planning for Northport.
Jim, do you accept
You want me to rewrite it?
No.
No, thank you.
Okay.
Jim, do you, what do we have to do?
There's a motion without an addendum on the table for approval.
That is correct.
I'm assuming you're saying that you would not accept a friendly amendment to your motion.
That's correct.
Is there a second to Mr. Henry's motion to amend the motion?
Hearing none, we'll proceed with the original motion on the table. Any further discussion? Hearing none, all those in favor of the motion on the table, please signify by saying yes.
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 Opposed, no. Okay, the motion passes.
If I may continue?
You may.
Bill Volgen, CFO, presented the information for the committee to consider for setting the preliminary tax millage rate for year 2019. He outlined the system's growth plans for 2019 and beyond, and he also reviewed the cost pressures that are impacting the system in preparing the budget for 2019. The taxable value of property in Sarasota County, including the value of new construction, has increased 7.4% over the past year. Management's recommendation is to set the 2019 preliminary millage rate at 1.0420, which is the same as the current millage rate. The board discussed the information as provided, and I move approval of the recommendation of the Finance Committee to set the 2019 preliminary millage rate at 1.0420, which is the same as the current millage rate, and to set the first public hearing to adopt the proposed budget and millage rate for September the 4th, 2018 at 5:01 p.m., and the second public hearing to adopt the budget millage rate for September 17th, 2018 at 5:01 p.m. Both hearings to be held in the board auditorium.
We have a motion on the floor. Any second?
Discussion, please, Jim. This
Hold
is-
on, Darrell, hold on a second, please. Do we have a second to the motion?
Second.
Okay, go ahead, Darrell, I'm sorry.
This motion is to set the maximum level,
That is correct.
can be modified later.
It can be modified.
lower.
It can go lower, but just can't go higher.
Very well, thank you, sir.
Any further discussion? Hearing none, all those in favor of the motion on the table, please signify by saying yes.
Yes.
Opposed, no. Okay, thank you. Jim, anything further?
Lastly, Mr. Chairman, Mr. Salt reviewed the selection committee rankings for the general contractors, architects, and engineers for the previously approved construction to replace OR Interventional Room 21. I move approval of the ranking of the general contractors and architects and engineers for the renovation of OR 21 as recommended by the Public Selection Committee and the Finance Committee as follows. General contractors, DeAngelis Diamond, J2 Solutions, Inc., and Bar & Bar, Inc., and for architects and engineers, Gresham Smith and Partners, LDC International, Inc., and Beck Architecture. And that concludes my report.
We need a motion,
Right.
Jim. You move in that regard?
Yes.
Okay, thank you. We have a second? Any discussion? All those in favor of those rankings, please signify by saying yes. Yes. Opposed, no. Thank you very much. Jim, anything further? All right, thank you so much. Board quality. Bill Noonan.
Yes, the Quality Committee met earlier today, but as that is a closed meeting, I do not have a report.
All right, thank you very much. Next up, David, on the President's and CEO's report. Tried to stretch that out as long as I could to give you a chance to get there.
Thank you. Thank you, Mr. Chairman. I'm going to start today, as I do each month, with take a look at our report card. This one is through June, fiscal year to date through June 2018. We start in our service pillar and look at our HCAP scores, where we have a goal of being 8 out of 11 of the domains at greater than the 50th percentile, equal to or greater than 50th percentile. We are coming in short of that at this point in time. We're at 6 out of 11. We are, I think, improving on many number of the scores, but we're still showing a 6 out of 11. I'll show you the detail in a minute. On the outpatient side, we have a goal of being at our outpatient number of domains at greater than or 50th percentile, 55 out of 58. We are 1 short of that right now. We're at 54 out of 58, and the team is very focused on making sure that gets up to goal. In the people pillar, we have a turnover of our part-time and full-time within the 12 months of hire. We have a goal of being at 25% turnover or less. Really happy to report today that we're hitting at 22.87%, which is the lowest number we have probably ever had, certainly in modern times. And so very proud of the team and leadership Lori Lang has brought to that. In the quality pillar, we have our goals be at the infection prevention, our combined overall standardized infection rate being less than 0.95. Just to remind the board that the national average or expected is a 1.0. We are coming in really, once again, at the lowest level we've ever seen at 0.79. So very happy with the progress that's been made there and through all the leadership with the medical staff and Dr. Fiorica, Dr. Gardner, and everyone that's contributed to that.
Pass along our thanks, because
I will. Dr. Fiorica, thanks.
Our volumes are off our volumes are up and our infection rate is down. You can't ask for better than that. Thank you.
It's really incredible. Finance pillar, we have our organizational indicators, our operating margin. As our CFO, Bill Wojcik, has just gone through, we have a goal of being 5.4%, which is our budget. We are projecting at this point in time an 11.2% operating margin. In the growth pillar, we have our strategic growth organizational goals. The first one is our inpatient admissions and combined with our outpatient observations. We have a goal of being 43,429. We are projecting that we are going to exceed that at 44,420. On the outpatient registration side, we have a goal of being at 789,301, and we are projecting to exceed that at 797,113. When we look a little deeper into our HCAP scores, you can see the 11 domains that are listed there. You can see what the national average is, and then you can see where we stand, which is in the middle column that contains the green and red. We are missing on 5 different elements of this: responsiveness to hospital staff, communication with doctors, cleanliness of the hospital environment, quietness of the environment, and then communication about medicines. There are a lot of action teams working on this right now. We not as an excuse, but we did have an incredibly high census this year. The numbers that we are seeing right now are coming through from the seat point in time in the season, and we are seeing some improvement going into that. But we do have 9 months of data here already. Moving into the service pillar, we did start doing some disaster test evacuation plans. It's just a good timing that we're walking into hurricane season, so we want to make sure we have everything ready to go, and just in case we have the unfortunate occurrence again this year. So in June, our Sarasota Memorial staff participated in training exercise in the SMH Command Center to test the hospital's response to a disaster requiring the evacuation of our patients to other facilities. Just to remind the board, when we had Irma this past year, I think Sarasota got very fortunate to have the storm shift at the last minute, but we still housed over 3,000 people in this facility, both patients and family members and others and employees. And we're very proud of what we had to do, but we definitely know that's not a given every year, and we need to continue to stay on top of our game to be prepared. So that's what's going on. Moving into the quality pillar, SMH named Cardiac Center of Excellence. Sarasota Memorial's Heart Program is the first in Florida and the fourth in the nation to receive the American Heart Association's Cardiovascular Center of Excellence accreditation. The cardiac team met or exceeded the following standards: 24/7 cardiovascular services, comprehensive training for staff, a strong systems of care approach for delivery of services, and extensive outreach to help our community recognize and participate in cardiovascular health. So congratulations to our team there. Staying in the quality column, SMH Emergency Care team earns prestigious Lantern Award. So Sarasota Memorial's main campus emergency care center is just one of 19 emergency departments across the nation and the only one in Florida to earn the Emergency Nurses Association Lantern Award in 2018. Honor recognizes the emergency departments that demonstrate excellent practice and innovative performance. So thanks to Connie Anderson and her leadership, along with Drs. Gerber and Holland for theirs. It really shows what an incredible organization we have there. Staying in quality in our simulation training impacts PEDS care. The ECC team and pediatric pharmacist recently participated in hands-on simulation training designed to enhance emergency care for pediatric patients. The Improving Pediatric Care Through Simulation is the initiative developed by the Yale School of Medicine, Johns Hopkins University, and other institutions. Moving into people, had the privilege today to introduce our inaugural and new president of Sarasota Memorial Laurel Road, and Sharon Roush is right here. Sharon, take a bow. There you go. So, thank you. Sharon will oversee the design, construction, and opening of Sarasota Memorial's new hospital at Laurel Road with its ongoing operations. A resident of Sarasota, Sharon comes to SMH from South Bay Hospital in Sun City, where she served as CEO of the 138-bed hospital in HCA Healthcare's West Florida division for nearly 10 years, and then held a number of CEO jobs before that. It's a big task in front of her and in front of all of us, one I think we're all ready and have been biding our time to do and to bring our services to Central and South County, Florida, or Sarasota County. Staying in people, we had our new Bayside leader participate on an expert panel recently. Bayside Executive Director Terry Cassidy, who recently joined our health system, was part of the special ABC 7 panel discussed the national increase in suicide rates and suicide prevention. The discussion aired in mid-June and also included information about where to find help in the Suncoast. And I did watch that show, and I thought she did a fantastic job. So earlier today, Dr. Berg introduced our third-year medical students. We also had the privilege of having our second class of internal medicine residents start this past July 1st. So we have our new 13 medical residents developed with FSU's College of Medicine. The program aims to offset our physician shortages in the community. Once we welcome our third class next year, we'll have our maximum in that program of 39 residents. So we're very excited about the development that is coming from that. I will tell you, one of the students that is in this class is Justin George, was actually graduated from FSU's medical program, our campus. So we're actually picking up our first resident from that. Thought that was kind of a neat circle of life. And he's promised me he will stay here and do his and practice here once he gets out of his residency. Moving into growth, as we talked a minute ago about our Laurel Road Hospital, we did have a workshop Sarasota Memorial and Laurel Road Hospital Design team hosted a neighborhood workshop in Venice on June 19th to discuss plans for the new facility. We're just working closely with the city and the county and all the communities out there to make sure we address all needs. I will tell you, it was a pleasure to be able to speak to the community and the people there. There was a number of our board members that were there. I appreciate your participation, and I don't think you heard anything but very positive feedback and welcoming.
All I wanted to know is, when is it going to open?
Yes, that apparently is the question, is that we can't open it fast enough for them. Staying in growth, we always have a number of seminars and meet the surgeon type things going on at the hospital. This month we have several with our bariatric surgeons. I just would encourage everybody to go on the website and take a look about when those are open to the public. Do ask that you RSVP just so we can make sure we have enough space. And that is my report, and I thank you for your time and open to any questions.
Any questions of David? All right, David, thank you very much.
Thank you.
I don't think we have anything on the consent agenda. Any public comments? No, sir. All righty. Caroline, any legal matters? Nothing for you. Any other business? Hearing none, we stand adjourned. Thank you very much.